It is 10 o'clock, so let's get started. Good morning, everyone. Welcome to the October 28th Public Health Media Briefing. We will have a quick update from public health staff, Dr. Kassirier, Rachel Allen, Hannah Alborg, and Jamie White, and then we will open it up for questions from the media. Just a reminder, this is the only media availability for public health staff today, so if you have questions, I highly recommend that you ask them in this forum. With that, I will hand it over to Dr. Kassirier.
Good morning, everyone, and thank you for joining us. So a quick update on the numbers, and I'm using numbers from yesterday. The dashboard may have been updated, but these are from yesterday. 156,196 cases of COVID-19 reported to Sacramento County. We are averaging up between 200 and 250 cases per day. And the case rate has been ticking up a little bit. Yesterday, it was at 17.1 per 100,000. With the deaths, we're at 2,323, and we're averaging about 4 deaths per day. With the hospitalizations, we have seen a little bit of an uptick in the numbers as well. The last update was 199 in the hospital compared to 176. Then with the vaccinations, we are continuing to make progress. 62.4% of the population has received at least 1 dose, and 57.4% are fully vaccinated. We have received some questions about what we think is causing the increase, and at least our initial look at the numbers does indicate that some of that might be due to the recent outbreak that we are dealing with in both of our jails, as well as some increase in our school-age children. With that, I am going to turn it over to Rachel.
Hi, good morning. I have some updates regarding vaccines. So I'll start with updates on boosters. I think since the last time we met, there's been additional approvals for boosters. So now individuals who've received either one of the mRNA vaccines, so that's Pfizer or Moderna, can receive a vaccine as long as it's a booster 6 months or more after their initial series. But again, it's for the same population, so 65 years and older. And those 18 and over who either live in a long-term care setting, have underlying medical conditions, or who work or live in a high-risk setting. But boosters were also approved for those who've received a Johnson & Johnson COVID-19 vaccine, and that's for all persons 18 and over who have received the Johnson & Johnson, and they can be vaccinated with the booster 2 or more months after their initial dose. The CDC did take an additional step and is now allowing for some mixing and matching of booster shots. So eligible individuals can choose which vaccine they want to receive as a booster dose. And you know, that's a decision they can make with their provider, or if they come to a clinic, we can talk through that process with them. A great place to look for more information on boosters is at our website, www.scph.com. And if you click on the vaccination tab, there's some guidance there. We are continuing our dual flu and COVID clinics, and we do welcome those for COVID doses who need first or second doses, and boosters as well. And we'll have an additional update about those clinics in a moment. We do ask that people bring their CDC card. We want to be able to add that booster dose to your card. And so it's very helpful if it's there, and so that we can look at it, make sure the timing is right, and then add that dose to your card. And then also, if folks would just keep in mind that boosters are not approved for persons under the age of 18. And the other thing I want to touch on is the pending approval of the Pfizer vaccine for 5 to 11-year-olds. So last week, the FDA met and did recommend this vaccine, but just wanting people to keep in mind it is not approved yet. So the CDC Advisory Committee will meet next week to look at the data. And then, of course, even when that approval comes through, we do need to wait for the Western States Scientific Safety Review. The rollout of this vaccine is going to look different. It is a different formulation. It is going to be shipped and pre-positioned, but it is not the same. It's a different packaging of the Pfizer vaccine. And so We do want to take time to ensure that we have training to make sure that we get this rollout right. And we want to make sure that staff are trained on the process. It's a different dilution and different handling. And so public health's primary role in this rollout is to work with our provider partners to ensure that they have adequate supply of appropriate vaccine and to give them support. And these are, pediatric offices or family practices that see children in their offices. And then CDPH is actually taking the lead to contact schools and set up school-located vaccine clinics. And so we are in constant communication with schools around that process, but the lead is being taken by the state on that. We do encourage, if and when it is approved, if you have a pediatric provider or a provider that you can go to, that folks reach out to them. We think that's a great setting for kids to be vaccinated in. I know some of the health systems have already reached out with communications to their clients. We will continue to evaluate our resources and work with CBOs doing our pop-ups in areas where there are inequities or low vaccination rates. And with that, I'm going to turn it over to Hannah Alborg.
Good morning, everybody. Since the inception of adjusting our vaccination clinic strategy 4 weeks ago, Sacramento County Public Health has hosted a total of 24 vaccination clinics. 11 of those clinics were classified as a dual clinic, which we offered both flu and COVID vaccine, and 13 of those were specifically for COVID. During this time, Sacramento County Public Health has administered over 1,400 COVID doses and over 1,400 flu doses at the 24 vaccination clinics. Of the 1,400 COVID administered doses, we're seeing about 60 to 65% of those doses are for boosters and 40 to 45% are for first and second doses. We continue to have really successful partnerships with our faith-based organizations, community-based organizations, school districts, and special events throughout the county. So to learn more about COVID-19 vaccination resources, please visit www.scph.com and click on the vaccination tab. Here you can find a list of clinics that are being hosted by Sacramento County Public Health along with our partners, and also links to retail pharmacies and medical providers. You can also visit www.myturn.ca.gov or call 211 to locate clinics near you. To learn more about our immunization assistance program and flu vaccine, you can visit www.sacvax.com to get the most recent and updated flu clinic list. I'm going to pass this over to Jamie White.
Thanks, Hannah. I just had a little update on a new epiometric that we'll be sharing on our dashboard. So we will be adding a third dose metric to the vaccine dashboard with the updates on Fridays moving forward. To start out, it'll be a combined metric of both those who received a third dose for reasons relating to their immunocompromised status, and it will include also booster doses. So it'll be anybody who had a third dose or an additional dose after completion of an initial series that was at least 28 days after that initial series. And I can tell you between August 12th and October 21st, there were 67,520 doses that were administered at least 28 days after the completion of an initial series. And then tomorrow, those numbers will be updated on the dashboard. And again, as we're able to, we will later flesh out those numbers in further detail. Right now, it's just going to be a combined metric until we figure out a better way to flesh out what specifically those are, if they are an additional dose or if they're a booster dose. That's all I have.
Okay, with that, we will open it up for questions from the media. As usual, please raise your hand. I will call on you. If you have more than one question, please re-raise your hand. I'll call on you again. And so, anyone have any questions?
I have a question.
Go for it.
Yeah, I just wanted to get the uptick case numbers again, 177 to 199. Just want.
Eden, you're cutting out. We didn't catch all of that.
I can type it. 1 second.
I'm going to have Michael with SACB ask his question.
Okay, hi. I just wanted to follow up. Are there any updated numbers on or related information about the jail outbreaks from last week?
The numbers I have are from last week, 32 at the main jail and 37 at RCCC. I will check with correctional health and get an update, and we'll have Samantha pass it on.
Brandy, go ahead and ask your question.
I just wanted to confirm that the vaccination population data is based on total population in Sacramento County, not eligible for the vaccination.
You do bring up a good question. The Sacramento County dashboard, the numbers that you see are based on total population for Sacramento County. The state also does have a separate dashboard where they show two numbers, one based on total population and another one based on those that are eligible. And so far it's been 12 and up. So those numbers are going to change once we start the vaccination for 5 to 11. So I think that's something that people need to look out for. If they see a reduction in the vaccination rates, that will be the reason.
Eden's question is, what are the updated numbers for uptick cases? Dr. K, can you just report what our current numbers are one more time, please?
Just want some clarification what is meant by the numbers for uptick cases. Do you want the totals or the percentage increase?
The total, please.
Oh, so the total I gave was 156,196. But that's a number from yesterday, and we do update daily. So in the interim, our epidemiologist may have updated it. So I suggest you do check the dashboard as well.
Sammy Kalo with Cap Radio is her question in the chat. Why did hospitalizations jump from 176 to 199 yesterday?
We are still looking at that. What we see, and I'll let Jamie jump in as well, is that most of the hospitalizations we are seeing are in adults between the age of 40 and 60. So, and many of them do have underlying medical conditions. And so, you know, they are vulnerable. Many of them are not vaccinated. So that's why it's really important for us to continue with the message of the importance of vaccination. And Jamie, do you have any additional information?
Yeah, I would just add, I think everything you said is correct. And I would just add that, you know, we're probably going to see some fluctuations, slight fluctuations in the hospitalization numbers. We typically see upticks in hospitalizations and deaths following any upticks in cases. But, you know, overall, looking compared to a couple months ago, the hospitalizations are still quite a bit down. And even, you know, the recent kind of fluctuations up and down in our case rate is really drastically down from, you know, mid-August, where we have a case rate of like 47 per 100,000. So now we're kind of bouncing around between the 15 and 17 range. So it seems to be more of a kind of a plateau kind of bump up and down than it is necessarily an increase. And I think it's too soon to tell whether or not this is going to be an increasing trend in hospitalizations. I wouldn't be surprised if we see them bump back down.
Michael, do you have another question?
Yeah, two quick ones. One, you mentioned that the uptick might be due to jails as well as in school-age children. Is there anything that is be classified as a school outbreak, or is it just general transmission? And second question is, do we have any? Does the county have any concerns, as we saw last year around this time, the surge as winter came and holidays and colder weather and all that? Or yeah, that's it.
I'll let Nick talk about the schools, but as far as the season we're in, yes, we do have some concern that we are going into the holiday season where there are a lot of gatherings, and also because it is the winter season and it's colder, these gatherings tend to be indoors. We do have guidance out for Halloween, and we will have guidance out for Christmas and New Year's and other holiday celebrations as well, just to help people to make sure that they're able to have these gatherings safely. But of course, the most important message is that if people are vaccinated, then that's the best protection for them. So Nick, you want to talk about the schools?
Yeah, I'll just share that since school returned for in-person instruction this year, we have seen some outbreaks in schools, generally self-contained, and we continue to see school outbreaks, but I don't believe there are any in particular at this moment that we would attribute to the general increase in numbers among 0 to 17 at this point.
The cases in children 0 to 17 constitute about 23% of our total right now for the past month. So I think this is a trend that we've noticed for a while, so it seems like it's still continuing.
And I would also point out that vaccination rates are lower in children than they are in other groups just because of eligibility primarily.
Which brings us to the next question in the chat. And Rachel, I'm hoping you can take this one. Can you share what some of our planning is that we have in place for children 5 to 11 when those vaccinations are approved?
Sure. So it's going to be late next week, we think, before approval comes. And like I said, we want to be a little bit more thoughtful with this because we're bringing a different vaccine into our workflow. So we won't be introducing it into our clinics until the following week, the week of the 8th. And it may be targeted clinics at first because we do need to make sure we also have staff who can appropriately vaccinate that age group at each of these clinics. Prior to this, the 12 and over population is more or less like vaccinating an adult. If they cooperate, but working with younger kids is different, and we want to make sure we have that planned. So as far as our clinics, I think you may start to see it the week of November 8th, if that answers the question.
I think that does. I am not seeing any additional hands raised or questions. Hang on, one more in. Anybody else? Last call. Questions from the media? Michael, do you have another one?
Just a quick follow-up on that last point. Do we have any sense of where we are expecting to be supply-wise? I believe Dr. Galley with the state set a statewide number of something like 1.2 million doses the first week. Do we have any rough sense of whether there'll be abundance or scarce at the outset?
Yeah, we're not told that there's scarcity of this vaccine, but there was a specific way that they rolled out the pre-positioning and pre-ordering that was a limited number. So I believe once we've passed those initial shipments, we should start to receive next week, ordering will open, and we're told there's not going to be a limit. So per my understanding, it should not be an issue.
Sammy, go ahead.
Yeah, I just wanted to ask one last question about testing supplies. I've heard some testing clinics say that they're low and they've had to limit who they test. What, if any, problems are we seeing there? And is there anything being done?
Liz, take it away.
So there was the possibility of a testing supply shortage a couple weeks ago. And so we were mindful of our antigen supplies. Right now, we do not have that challenge. And so no community members accessing testing at our community testing sites through the county should have any issues with getting either a PCR test or an antigen test.
Okay, thank you. And can you just clarify briefly who should get tested at this point?
I'm going to pass that over to Dr. K or Carlos.
Since there's no limit in the limits with the supplies for the tests right now, anybody can go in and get a test, but definitely if somebody is exposed or if somebody is exhibiting symptoms, they do need to get tested. There are also certain workplaces that require testing now for, especially for those that are not vaccinated. And so those need to get tested as well.
Thank you.
Okay. With that, I am going to conclude this week's public health briefing. We will evaluate the need for one next week, and you all will receive an email from me if we are going to have one. And as usual, I will be sending a link to this recording out this afternoon, and it will be posted on our website. Thank you all for joining.